Good day, everyone. I wanted to take some time out today to talk about one of the most contentious issues in all of fitness and wellness, GLP-1 agonists like Wegovy and Zepbound. This is a topic that, as a fitness professional, right now is sort of impossible to navigate around. It's a really popular topic of discussion. A lot of fitness influencers have come out pretty hard against these drugs, advocating for a whole bunch of other medications and approaches. This is likely because they're about to be found out to be charlatans. They've been saying for decades that there's one thing in your diet that you're doing wrong that's causing all the problems, it's causing all the weight gain, and that was never true. You have one side saying that you should be on carnivore and that vegetables cause all sorts of problems, and on the other side you have vegans who say that consuming meat causes all your problems. Both are incorrect, and for those of us who have been in the know for quite some time, this was obvious all along. It might be a bit of an oversimplification to say that what these drugs do is keep food in your stomach longer, which makes you less hungry. And being less hungry, you tend to consume fewer calories. The truth is, long and short, most of the problems with the American diet is just that people are over-consuming calories from any source. And any problem caused by the excess consumption of a whole bunch of calories is going to be treated by lowering those calories in your diet. So problems like hypertension, high cholesterol, obesity, diabetes, prediabetes, blood sugar issues, all treated with one drug at the same time. So I did want to take a little time out to talk about some of the questions and some of the concerns that people have had and expressed to me about taking these drugs. The first and most common one that I hear is people concerned that they're going to lose all of their muscle mass or a disproportionate amount of their muscle mass due to these drugs. I've heard this from a couple of influencers as well. The truth is, the total amount of muscle loss is exactly predicted by the caloric intake, with or without the drugs. So if you were to create a really high caloric deficit, you're going to create a little bit more muscle loss. If this is compounded with a lower protein intake and a lack of resistance training, yeah, you're going to lose quite a bit of muscle mass. But the treatment for that is actually pretty simple. Keep your protein intake high and do resistance training. You'll tend to sustain a lot more muscle mass. You'll be burning more total fat. The second one, and another understandable concern, is I've heard people say that they're concerned that we don't really know the long-term effects. Well, the truth is we actually do. The drugs first came out in 1990. It was exenatide at the time. They've since gone through a couple of different successive rounds of improvement where we can lower side effects and increase the primary intended effect. In fact, these have been used in almost exclusively populations of people who have clinical problems, diabetes. It's a syndrome that creates all sorts of issues across multiple systems, and yet the drugs are safe for that population. So the healthy population seems like it'll be just fine. The third concern I hear people express rather often is the possibility of rebound once you're back off the drugs. The GLP-1 agonists sit in a class of compound that is pretty unusual insofar as there isn't a negative feedback loop. We know about those because of things like caffeine. You start taking a small amount of caffeine, maybe a single cup of coffee, and maybe a couple of months later you need 2, 3, 4 cups of coffee to get the same effect. It's a negative feedback loop. It creates a degree of dependence or resistance. The GLP-1 agonists do not have a negative feedback loop like that. Whatever dose worked to get you down to a certain body weight on day 1 will work day 1000, right about the same. Coming off the drug only means that you have a slightly smaller stomach and just the same appetite as you did before. There have been some concerns expressed about pancreatic stress. There's actually legitimacy to that. If you have pancreatic issues or if you've had pancreatic tumors in the past, then for sure this class of drugs might be inconsistent with your medical background. However, for almost all healthy individuals, even those with certain advanced cases of diabetes, these are still incredibly effective drugs that do not cause long-term problems. Now, we do need to talk about target populations and ideal patients. People who have a tendency to eat pretty well, but then overconsume calories or struggle with portion control, and also who engage in regular activity, are pretty much your ideal candidate for these drugs to be used. These medications can be incredibly effective at helping them drop weight simply on portion control alone. And they're already doing the things needed to ensure they don't end up with sarcopenia and don't end up with a whole bunch of weakness. That does mean there is a not so ideal population. Those who have diets that are incredibly low in protein, really low in micronutrients to begin with, really high in calories, these are not a good target population for these medications. Other interventions need to be used first to shore up problems that can be fixed just by shoring up content of the diet. Once content has been modified such that it is improved, now the drugs might be more useful. But for people who have really awful diets to begin with, it turns out you're just making a lower calorie, really awful diet. And that can create certain other micronutrient and macronutrient deficiencies that can lead to other issues. What I would like to see going forward is both medical professionals and fitness influencers having much more nuanced and thoughtful conversations surrounding these drugs, involving the research and involving bigger populations that are being investigated, rather than dogmatic approaches to either their glorious benefits or to their downfalls and perils. I think that's what's going to be needed to have this conversation going forward.